Hi everyone. So we are moving towards very important infections in the organs which are being related to it. So in this scenario of like COVID-19, we have faced some of the obstructions, some of the infections which are specifically choking the respiratory tract. So what are the herbal remedies that can strengthen that respiratory tract, and we can generally get rid of these typical ailments or typical diseases which can be a type of long ailments or can be a type of you can say a short term effects, can induce short term effects, or can be probably the cause of long term infectious issues. So today we'll be discussing about some of the herbal remedies basically for your respiratory tract and the infections related to the respiratory tracts. So, if we talk about the respiratory system, the drugs basically which are being associated with these respiratory system, they are being divided into important categories. So, we start with a demulcent category. Then you have expectorant category. Then you have antitussive category, spasmolytic category. Then you have anticarals and immunostimulants. So, when we start with a demulcent, demulcents are the category of those herbal drugs where an agent that forms a soothing protective film when administered onto a mucous membrane surface. For example, mucilage and oils, they can act as demulcents that can relieve irritation of the bowel lining, making it very smooth. So basically, it is smoothing that respiratory tract that is generally going for destruction of those heavy mucus plaques which are being deposited in the respiratory tract and can be a type of issue that can pose a risk towards the respiration problems, breathing problem. So mainly demulcent, it generally purifies, generally smoothens the type of mucus membrane surfaces. So major respiratory demulcent herbs, when we talk about, we have Althesia officinalis. Its roots and leaves, mallow flowers can be used. Respiratory demulcents, these are the herbs, they contain mucilage. I already told you, and they have a soothing and anti-inflammatory action, thus making it a very smooth tract. So indication for respiratory demulcents are like dry, non-productive, irritable coughs are there. So application best, they can be taken before meals. So if we talk about these typical type of herbs, they can be marshmallow, that is Althea officinalis, which we talked in the previous slide. If we talk about the constituent here, the dried root, it contains about 35% of the mucilage starch. Action and uses, typical demulcent cough remedy is being used here. So preparation is typically by the maceration or the cold maceration for several hours to ensure that the mucilage and not the starch is extracted. So starch doesn't dissolve in cold water. So the main target is to extract that smooth mucilage. Then we talk about the expectorants. So expectorants are the additional categories after demulcents. So expectorants, they are generally the medicines which are promoting the secretion of sputum by the air passages, which are used to treat coughs. So the combination medication is used to relieve the cough caused by the common cold. It can be bronchitis condition or other breathing illnesses. So here these are cough remedies that liquefy that viscid sputum so that it can be cleared by coughing. So they are generally accelerating the pathway to get clear, and finally it can be get through by clearing it by the cough and all processes. So this is affected by the fine hair cilia that is prominent in the ciliated epithelium, which push the mucus in typical waves towards the outside and generally clears that abnormal mucus, or by changing its character and making it more clearer and smooth. It includes three categories: stimulant or reflex expectorants, then you have warming expectorants, then you have warming expectorants with respiratory antiseptic effect. So if we talk about the first category, the reflex expectorants, we talk about those remedies which are generally going for provoking or increasing the mucociliary activities so that by this reflex stimulation of the upper digestive wall. So classic examples which are related to it, you have various quills, you have primula, you have saponaria, seneca. All these are the categories under your stimulating expectorants. Then stimulating expectorant, it should be kept under view in cases of like if you are facing the dry and irritable coughs, if you have asthma, in typical young children, and also in type of dyspeptic conditions also. So application is basically they are being taken in hot infusions of fluid extracts, and long-term therapy is usually acceptable here. Then we have third category, we have warming expectorants with respiratory antiseptic effects. We have basically the herbal plants like scabwort roots, you have thyme, you have guajava leaves. So all these can be used in typical treatment of these ailments. Then you have warming expectorants. So these generally include aromatic and some of the fungal species, pungent species also. So aromatic, when we talk about aromatic, you have like cinnamon, you already know fennel, anise, angelica. Then you have pungent species like you have ginger, because ginger it generally probably includes all the increased blood flow to respiratory mucosa, and a reflex irritation it generally causes in the upper digestive mucosa, and it acts as a type of stimulating expectorant, generally flushing that mucus out. Then you have sulfur containing herbs also under the warming expectorant. So you have garlic, mustard family, which decrease the thickness of the mucus and it alters the structure related to a mucopolysaccharide constituents. Then application, if we talk about application, it is also preferred in type of hot aqueous infusions. Then you have next one is the typical herb, which is like alkaloid basically. And this typical exporterant, it is like 20 mg root powder is being taken, and high doses it may cause adverse effect also. So if mechanism of action, if we talk about the mechanism of action, we are talking about the low doses that stimulate the gastric mucosa, and it leads to a type of reflex effect on the bronchial mucosa. And finally, the typical gastrobronchial mucus reflex action gets stimulated to the hypersecretion, and that is increased amount of that thick sputum is being seen there. Then you have primula, that is also known as the cow slip, rock slip. So you have constituents here. The active constituent or bioactive constituent here is triterpenoid saponins. That is basically in a percentage range of 5 to 10%. Cellularic acids are also, and some of the volatile oils also form the important part of this typical herb. Then it acts as an expectorant, that is generally decreasing that clogging of the pathway or the parts by the thick mucus. It finally flushes it out, and it is mainly due to the stimulation of the mucosal lining and the resultant triggering of that parasympathetic reflexes. Then you have Seneca. So constituents here, it consists of a very important bioactive component, senegan, that is 6 to 10% here. And action and uses, it act as exporterant and emetic. Then you have soapwort. It contains 5% saponin, and it is also acting as an exporterant. Then you have fennel. So fennel you must have heard, that is Feniculum vulgare. It acts as a type of volatile oil component, and it is composed of some of the methyl cavicol, flavonoids, quercetines, and all, and it is being used as a flavoring agent and a mild exporterant. Then if NSA, that is also a type of volatile oil, which is like composing of 2 to 3% of volatile oil, and it is also used as flavoring agent and exporterant. Then you have thyme leaves. These are also very active and can be administered orally, and this is being eliminated by the pulmonary alveoli. So hence, these concentrated drug effects occur at a site of the disease. Then you have guajava leaves. These are also expectorant and antiseptic for the respiratory tract, and they usually come in type of cough mixtures. Then you have anti-tussive. So anti-tussive, if we talk about anti-tussive, we talk about a very important category which refers to all these remedies which are used to prevent or relieve the cough. So it can generally be referred to the remedies that depress the cough reflexes. So here the application, they are being taken before meal. So we have opium poppy, that is Papaver somniferi. This codeine is generally used in the form of the water soluble codeine phosphate, and typically sedative cough remedy is being implemented here. So it has two important actions, that is depressant effect on the cough center and general sedative and analgesic properties. If we talk about cough remedies for external use, inhalation, chest rubs, you have vapors of selected drugs that can be administered by various processes like inhalation. That is the most common method. Then you have some of the chamomile infusions are also taken for inhalation, which gives you like a soothing effect in the respiratory tract. Then finally, you have thyme herbs, you have dwarf wine oil and all. Then you have some of the spasmolytics. So this is also a category which is very important drug or treatment which is able to relieve the spasm of the smooth muscles basically. So these herbal drugs, they can be recommended as adjuvants for the use in the transmission period between attacks. So indications for respiratory spasmolytics is like tight, breathless, non-productive cough, wheezing, and other asthmatic symptoms. So these symptoms are related to this condition. And finally, you have various type of herbs like you have khela, that has typical type of furanochromons, pyranocomerins, and ephedrine. So ephedra is the type of, indirectly you can say, it stimulates the release of norepinephrine, and it releases the spasm of the bronchial muscle. So basically it is acting on the spasm of those bronchial muscles. And allergic conditions are also like responded well by ephedra. And then you have anticarherals. So these are the herbs that act on the body's mucus. So if we talk about these typical type of anticarherals, they have like plant remedies which are being used as typical anticarherals. That is euphrasia, you have sambucus, you have solidago, you have hydratis. So indication is like they work especially in the upper respiratory tract, and like your sinusitis or otitis media, that is the infection of the middle ear. Then you have allergic rhinitis and other hypersensitivity conditions. Then you have immunostimulants. So this is another category. The use, you know, that immunostimulants, they are the substances that stimulate the immune system by inducing activation or by increasing the activity of any of the component. The use of these immunostimulant is promoted for the preventive therapy of various respiratory diseases and other infectious diseases, like you have acquired immunosuppression, you have some of the problems related to your respiratory tracts and all. So these include your Echininia, then you have Picoriza, black seed, Nigeria sativa, then you have Veldal flowers, then you have Telia. So all these typical herbal plants are constituents are used in these typical type of infection, and they act as a type of immunostimulants. So if we talk about elder flowers, that are from like the scientific name is Sambucus nigra. So constituent here, the active components are flavonoid, phenolic acid, steroids, and terpenes. So actions immunostimulant. Then you have telia. The constituent here also remains the same bioactive component. Then you have vitamin-rich medicinal plants that are, you know, that basically vitamin C's are typically consumed for to fight against various disease and to become resistant to various diseases. So in this COVID period, we are utilizing much vitamin C to boost and to stimulate the immune responses. So in this case, lemon juice is the best known source of vitamin C, and it also contain the several type of hesperidin, and this is very effective in treating the typical disorders like scurvy. Then you have acute bronchitis. So this is the condition where the bronchi are like suffering from acute inflammation and swelling processes. So here also immune enhancing herbs like from Echenia, Picoriza, Nigella sativa, Astragalus. So these are being used here. Then you have chronic bronchitis emphysema. So this is also using the antitussive herbs, especially at the night. You can also go for anticatarrhal herbs, especially verbasum and hydratis. And finally, anti-inflammatory herbs can also be used, such as glyceria and omega-3 fatty acids. Then in case of acute and chronic sinusitis, you can go for various type of antiseptic herbs like Thymus vulgaris, Allium sativum, that is prominent in your onion. So inhalation of peppermint and eucalyptus oil is also considerable. Then mucolytic typical herbs such as Allium sativum, they are being recommended in these cases. And typical anticatarrhal categories of herbs like Verbascum and Hydratus is being recommended in these cases. So thank you. Thank you for your kind attention.